Hello and welcome to this episode of Health in You. I am Sumi Sukanya Datta. Last week, social media was abuzz with video clips showing former cricketer Navjot Singh Sidhu saying that some herbs and dietary modifications helped his wife beat advanced stage breast cancer. This prompted Tata Memorial Centre, which is India's top cancer institute, to issue a statement saying not to rely on unscientific and unproven methods for cancer treatment. Now, we keep hearing about anti cancer properties of several supplements and medicines which are used in traditional medicine. But what does science say? To discuss this, we have two eminent oncologists, Dr. Mandeep Singh Malhotra and Dr. Vedant Kabra. Dr. Malhotra is with CK Birla Hospital in Delhi, and Dr. Kabra is Principal Director of Surgical Oncology at Fortis Memorial Research Institute at Gurgaon. Thank you so much, Dr. Malhotra and Dr. Kabra, for joining us today. What were your thoughts when you heard these claims by Sidhu that dietary modifications helped his wife beat cancer? We would like to start with you, Dr. Malhotra.
So first of all, I heard just a small shorts. In that shorts, it was being. I felt that he's advocating that you should look into dietary modifications. You should look into some new herbs and treat cancers. So this is obviously now since I was having a conversation with Dr. Kabra itself that if we look into the whole aspect of it, yes, he has undergone the conventional treatment in form of surgery in form of systemic therapy, chemotherapy, radiation, and etc. So the thing is that the first message should be clear that yes, the conventional treatment is the standard of care. Now, the concept of herbs and dietary modification, if I really look into the fact, yes, there are certain researches, there are certain facts which should be looked into and explored. Like this, there is a simple fact when he's talking about a low glycemic diet.
Right.
So when we are looking into cancer evaluation, like PET scan, what is PET scan? PET scan is a glucose labeled radionuclide. And when we do a PET scan, we say that we you inject this glucose, and which is the most metabolically active cell, it get concentrated into that, and then we click a scan. So yes, cancers are the most metabolically active cells, and they do feed on glucose. So a low glycemic diet, there has been a research in Nature even, which suggests that low glycemic diet will help in cancer control in a better way. So, and then yes, there is a role of herbs. The problem with the herbs is that we have researches which are still in cell lines, which are in genetic, which are at basic level researches, which have shown that herbs or nutraceuticals is a better way to say that, have an important role in certain cancer pathways, and they will definitely help in supporting cancer treatment. But the problem is that this thing has to be more researched, more explored, and then we can bring it into a more proper way into the conventional treatment forum. It should not be that you carry on with healthy and you will get cancer cure. So that message should not be given. But yes, it should be explored more.
Yeah. To inform our viewers further, I would like to mention some of the names that he mentioned that included haldi, as you said, turmeric, apple cider vinegar. He also mentioned about spiced tea and berries, particularly. He said that, that was really crucial for his wife's treatment. Dr. Kabra, would you like to add something to what you thought about these messages?
Oh, right, Dr. Mandeep has said very rightly. What we initially got to hear was only part of the video. This was a
Mhm.
very long press conference of nearly 40 minutes, and what we were hearing was barely 4 minutes.
Right.
And media had selectively, decided to make that viral. Viral. I would not say that media makes it viral. It is the viewer who would make it viral because more and more people would see. So we got an impression that he's saying that this is what cured her, when I actually heard the whole video, saw the whole video of 38-39 minutes, and I realized that they have given a sequence of treatment which was done. And I have also heard the video of the doctor who treated her. So basically she had a surgery first, she was undergoing chemotherapy, and then the time of radiation came when she skipped it because she was worried about her cancer and she was worried that she may not see or live to see his son getting married. So she
Right.
got her son married, and there was a delay. Because of the delay, cancer recurred in the local area and the skin of the chest. Because breast was removed to the flat chest, there were multiple areas in the skin. So, it is not in true sense a very extensive stage 4 cancer, but locally recurrent cancer, for which she again took chemotherapy. Probably, I am not sure about this part, but she definitely underwent surgery and radiation. So all this was going on, and while chemotherapy, he asked his oncologist whether they can do nutritional therapy or not. Now, in general, if you ask any oncologist, they would be very wary of using any alternative therapy together with chemotherapy. What happens? There are many alternative therapies given without supervision by quacks. There are quacks in allopathy and there are quacks in Ayurveda also. So they may do more harm. They may have interaction with chemotherapy, which can increase the side effects or produce new side effects. So in general,
Right.
oncologists would say, please don't do it right now. And they said no. However, what Mr. Sidhu was aiming at was just to modify the diet to make it more natural, right? Moving away from wheat, from sugar, from dairy products, and going to raw things like vegetables and all. Now, there is another idea in our country, and rightly so to some extent, that please don't take raw food while on chemotherapy. And why do they say that? Because the raw food that we get from outside may be contaminated with various bacteria and viruses and can cause infection. A patient on chemotherapy is low on immunity. In Western countries, they never stop you from taking raw food or fruits and salads, but here we are bound to do it sometimes because of the prevailing conditions in the country. So for my
Right.
patients, I always tell them, by all means, please take raw foods, please take fruits, but wash them carefully, wash them nicely, keep and use them hygienically. So probably because of that, the oncologist might have said, this is what my thinking is, but they nevertheless continued on that therapy. And as Mandeep did point out, nutrition is very important for your health, but to rely on it for treating a cancer completely, I think in current times it is amounting to foolishness. There is a lot
Yeah.
of research going on, there is no doubt about that. There is some evidence also, again, no doubt about that, but the evidence to a level where it can replace the existing standard of care is missing. If a
Right.
patient comes to me, I always tell them that what I am doing is one part of the treatment, or I and my colleagues would do. What you will do is equally important other part of the treatment. And what comprises that other part? Keep yourself healthy physically, mentally, and maybe spiritually. Have a good diet, have a healthy diet, keep exercising, keep physically active, and keep positive. So what is healthy diet? Healthy diet, in my opinion, is something which is locally available, which is seasonal, and which is freshly made at home,
Right.
right?
Yeah.
Now there are many things. People talk of sugar. Sugar is also an artificial thing. Sugar is not a natural thing. Wheat was not there few hundred years ago. Wheat got introduced much later. So instead of that, millets is a better option. Instead of sugar, there's something called gur or khand, which is in the purest form, is a better option. And as Mandeep also pointed out, any cell which is actively dividing or very active metabolically will obviously need some energy source. And sugar is a very, very easy energy source, easily available. So people say it feeds cancer cells, as if it feeds not only cancer cells, it also causes cancer. What sugar does is to make you obese, make you gain weight, fatty liver, and all these conditions can ultimately lead to many chronic diseases, including cancer. So that's how probably the mechanism is. Uh, we have to understand that we cannot move away from the standard treatment which is prescribed right now.
Yeah. So both of you mentioned about, patients largely relying on, should be relying largely on the standard care of cancer, which is given as of now. But are there any supplements, any herbal? I understand that both of you would be too busy to sort of advise or guide patients through their diet plan or something like that. And there would be other specialists for that thing. But are there any supplements, any indigenous form of medicine that you think can be sort of supplementary to the standard care of treatment? Dr. Malhotra, would you like to answer that?
Yeah. So first of all, the fact is that right now we can even understand the cancer metabolism. Like
Right.
as Mr. Sidhu said that low glycemic diet. So there are certain cancers which run on glucose. There are certain cancers which run on glutamine. There are certain cancers which run on lipids. Now science is advanced, and we can now identify whether this cancer is running on glucose, whether this cancer is running on glutamine, or whether this cancer is running on fat or lipid. So accordingly, if my patient has
Mm-hmm.
a high glucose kind of diet, a high glucose metabolism kind of cancer, we can look into restricting sugars and all. Coming to the nutraceutical aspects of it. So nutraceuticals, yes, are very important, and there is a lot of researches which are going in place. Like for example, Mr. Sidhu mentioned walnuts. So what is walnut? Walnut is resveratrol, quercetin, and omega-3 fatty acid. Omega-3 fatty acid induces your immunity, and immune system is much better. So if my patient is on immunotherapy drug, so obviously it will help. Quercetin. Quercetin is a natural supplement which actually reduces the genes of cancer resistance. Like if my patient is on chemotherapy, if I add quercetin to that, so my chemotherapy response would be much better. What is resveratrol? Resveratrol again is a nutraceutical which will reduce the cancer stemness. So my cancer recurrence would be much lesser. But the catch to this is now he also mentioned on lime water, nimbu pani. So when you talk about these, so this is vitamin C. Now there is ample research which says that vitamin C in very high forms, like high dose vitamin C, it can definitely induce my chemo effectiveness. My chemo will be much effective. The side effects of chemotherapy are much lesser. So what happens is that I can achieve much better results in a very limited doses or limited side effects. But the catch to it is that there are certain things which are antioxidants and there are certain things which are pro-oxidants. The knowledge where we lack is that how to use them effectively. It should not be that I am using an antioxidant such as quercetin within the half-life of chemotherapy and my chemotherapy becomes ineffective. So basically then rather than having benefit, I'll be causing more harm. Similarly, I should not be using a pro-oxidant like high dose vitamin C after the half-life of chemotherapy, then again I'll be causing more harm. So the thing is that yes, there are researches, there are a lot of researchers, there are researchers in journals like Nature which have suggested that yes, nutraceuticals should be used, but the problem at this point of time is that we have not been able to use it integrated effectively. Yes, it's there. We should now anecdotal experience is there. Like Mrs. Sidhu benefited from it. They might have used it in the right way. That is how it is. But there are a lot of things times when we see that the patient in actual getting benefit, they get harm. So it has to be undergone under very strict. First of all, if you don't have ample research knowledge about it, please don't use it. Secondly, don't use it by yourself. Use it under a team or under very strict medical supervision who knows what it is, who knows what is the harms, what is the interactions, what are the side effects, and then yes, use it. And lastly, we still have to wait for more researches, more evidence to come forward to use it as a common prescription to everybody. That is my take on it.
One common understanding that many people falsely probably have is that Ayurvedic or alternative medicine, even if they don't do any good, is probably they don't harm. That's why there's no harm in trying it, right? So many people actually use it that way also. But I was talking to some doctors at Tata Memorial, and they very rightly pointed out probably that there is something called drug interaction that is also a very crucial aspect and shouldn't be ignored in case of cancer treatment as well. So, Dr. Kabra, would you like to talk a little about, what probably some nutraceuticals, though there is some research happening in India as well by top institutes like AIMS and Tata Memorial on, utility of these medicines like ashwagandha, guduchi, and turmeric for managing side effects related to cancer treatment. But would you also like to talk about this drug interaction that some nutraceuticals, if unsupervised way they are taken, can cause?
So I will give you a couple of examples. One
Right.
is from cancer, one is from non-cancer. During
Mhm.
COVID days, haldi, nimbu, and then kadha and all those things were made very commonly they were used. People went overboard. They took it 4 times, 5 times, 6 times in a day, ended up with liver failures, jaundice, because of excess use of it. Even I used haldi, right? Haldi is good, but I was using that kala once in a day, knowing very well that these are good things, these are nutritional nutritional spices that we use anyways every day, but you can't do it 6 times. That is the harm it caused. Now, giving you one example of a patient of mine who was taking a lot of nutraceuticals as a healthy person, young lady. She came to me with breast cancer, and while I was taking history, I found out that she was taking three different nutritional supplements, young lady in her 30s, which contained soya. So when you add up, soya is high in estrogen. Estrogen is a driver for causing breast cancer growth, or breast cancer cells can grow with lot of estrogen levels. This, and there were other risk factor there, but this was one of the things that I could find out in her history, which would have led to it. So mindless use of nutraceuticals without realizing that you are overdosing yourself with one of them can cause all these problems. Then there are Ayurvedic medicines which sometimes contain heavy metals also, which may be
Yeah.
very high in content and can cause liver failure and kidney failures. We have seen all that. So you mentioned about research, ashwagandha, guduchi. See, these are, I am a believer of Ayurveda. Although I have not read it, but I am a believer because it is a science. It is a very ancient science, but it has to be read properly, understood properly, and practiced properly. You know, Ayurveda extracts medicines from plant sources. Do you know the initial cancer drugs? They were all taken from plants.
But
And
plant
then,
extracts,
yeah,
right?
yes, antibiotics came from plants. And now later on, we are modifying them. We are making synthetic forms to decrease the side effects and increase the effectiveness. But the initial source has been plant. So we don't deny that. It has been probably origin has been from one place, but we have diverged. We have lost the wisdom somewhere. We have to regain that, but retest according to modern scientific methods. Unless
Right.
it is done, we cannot use it. A lot of research is happening, a lot of pieces are there, but those pieces have to be brought together and the puzzle solved. Unless
Yeah.
it is done, as Dr. Mandeep also pointed out, you don't know which nutraceutical to use in which phase and in which cancer or with which chemotherapy drug. You use it wrongly, you have it. You are
Yeah.
lucky to use it rightly with proper research. Yes, very good. So the message has to be correct, and the use has to be correct, scientifically based, under supervision, and in the knowledge of your treating doctors.
Yeah. So the key message is that don't use these medicines without talking to your doctor, your
Yes,
oncologist, and
yes.
well,
So, so Mr.
somebody in the
Sidhu has
family.
also said that I am going to tell it to the nation. I will tell everybody. It might have worked for his wife for her type of cancer. That same regimen may
Might
not
not
work for
work for
everybody.
everybody else.
May not
Yes.
work for everybody, but yes, it's no brainer. You take raw food which is naturally available. You don't cook it. You avoid fried food and other junk food. It's no brainer that you will become healthy.
Yeah. Absolutely. Yeah.
But
Dr.
the
Manoj,
yeah,
you want to say something?
like when he said that you take haldi. So this is research from India which I am quoting. So haldi has curcumin, which is the
Hmm.
active compound.
Yeah.
So when you have curcumin, I have for curcumin to work as a wound healer, it's a different dose. For curcumin to act as an anti-cancer, the dose has to be 3 to 4 grams of curcumin. For me to give my patient a 3 to 4 grams of curcumin, and the amount of haldi somebody has to consume is very immense. So, and how does when I take that amount of haldi and curcumin or that amount of haldi, how my gut would function? Somebody's liver metabolism is different. Somebody's metabolism. So how would they metabolize? And what is the bioavailability? Bioavailability means the problem with all nutraceuticals is that for any cancer drug to come, it undergoes a phase one, phase two, phase three trials. So we understand what is the dose, what are the side effects, how I should give that drug, whether I should give a tablet or whether I should give an injection, and what is the injection formulation. Now, how much curcumin and which is the method, which is the carrier that my curcumin should come into that blood level of 3 to 4 gram to act as an anti-cancer. So that is the thing which is missing. But I really want to congratulate the fact that this discussion is happening. Why? Because now, if you understand curcumin, Again, quoting a research from India. P53 is the gene which is a suppressor mechanism. Basically, if I have cancer, my P53 is generally deranged. So P53, if my P53 is deranged, I'll get cancer. My body's defense mechanism against cancer is not there. Whereas curcumin is known to enhance the P53. So my body's natural defense mechanism against cancer would be much, much higher. And this is a very important important fact. It should be researched. He's talking about berries and all. So it has ellagic acids. Ellagic acid is a known drug to prevent metastasis. The VEGF, that is the angiogenesis, it decreases that. Now, there's another important fact which we should understand why this debate is very important. The cost. When you talk about nutraceuticals, the cost is much lesser, whereas conventional targeted medicines are much, much expensive. So, a lot of Indian patients can actually benefit it, but yes, it has to be researched, it has to be developed. Like, I'll give you an example. The latest, there is the professors from Jamia University, so they have developed a nano like form of curcumin which can be given. So yes, they have looked into the bioavailability of it. But yes, now we have to look into the interactions. So what I mean to say is that yes, this debate is happening. It is a very good thing to happen. We should look into it. It has to be more researched. And the fact is, then it has to be integrated together so that we can actually reap the benefits out of it. But
Right.
there is a lot of logic behind it. There is logic behind low glycemic diet. There is logic behind nutraceuticals. It is just that our knowledge is still not mature enough. I'll give you one example more. In China, so there was every month there are four papers which are coming on nutraceuticals. There are in Germany, there
I
are
see.
now testers. They have developed now research methodologies which they even test whether curcumin is working for somebody or not. So yes, across the world this is happening, and we should also, since this is, as Dr. Kabra said, that this is our science. Ayurveda is our science, our method. So we should actually be the world leaders in deciphering cancer treatment, integrating supportive cancer treatment, and then getting more benefit out of it.
So the proper way probably is to subject these nutraceuticals or indigenous form of medicines through the modern principles of science, put them through rigorous clinical trials to show whether they work in patients in actual
Yeah,
conditions, right?
they have to undergo the rigor of clinical trials which other drugs have undergone. And one word of caution: this nutraceutical industry is flourishing and exploiting people. People are coming with nanocurcumin, which he mentioned. I very clearly remember one person came to me with this is nanocurcumin capsule. You know how much it was costing? It was more than 100 rupees a capsule, and they had to take some 4 to 6 capsules a day for a long length of time, and then say this is water soluble and this and that, because haldi, content of curcumin in haldi is not enough to be taken practically. If you take so much of haldi, you will have side effects, which Dr. Mandeep also mentioned. Now
Mhm.
that capsule I just opened up and poured the contents in a glass of water which was kept in my OPD clinic. It did not dissolve. So obviously
So probably it's not dissolving
he
in
was
the body
telling
now.
me a lie. He was telling me a lie. What I realized, it was a capsule filled up with haldi, nothing else, and selling at 100 rupees a capsule. So
Actually,
we have to be
the
careful,
nutraceutical
very,
comes
very
under
careful.
the food FSI. So the
Yeah.
quality controls for manufacturing and selling nutraceuticals are less stringent.
Right.
Whereas if the same thing has to come from a, so it is still as a food supplement. It is not sold as
So
a
you
Not
are
drug.
as a
using
drug,
you are
not regulated as a drug, most
you are
importantly.
Exactly.
using a nutraceutical as a pharmaceutical.
Yes, yes.
Understand the
Exactly.
difference.
That's a
You have
very
not
important
undergone. You have
thing that
not.
you pointed out, sir. But
Yes.
probably that can be part of another debate that we have on this topic. So to summarize, I would like to request both of you to give quick message that our viewers can benefit from. Dr. Kabra, would you like to start?
Yeah. So my message is very clear. Firstly, be aware of cancer. Participate in self-examination and screening. Detect it early. Treat it by conventionally proven standard methods of treatment. By all means, you can supplement it with other things with the consent of your treating doctors, as well as consulting experts into the field, avoiding overlap, avoiding adverse events, especially during chemotherapy, which it may happen. Remain healthy, keep your lifestyle healthy, and I think I see no reason why you will not have the best outcome. Now, best outcome may not be 100% cure, but at least you will have the best outcome. If you do all these things, you have 90% cure rate. If you don't do, you may have 80% cure rate. That difference can come if you do it holistically.
Yeah.
But please do not delay, do not delay the standard of treatment, standard care of treatment.
Dr. Malhotra, please.
My take is that dietary modification, nutraceuticals are not alternative to standard care. The standard care remains where it is, and this has to be done. Now, yes, there is a lot of science behind it that dietary modifications and nutraceuticals can play a supportive role in cancer treatment, conventional cancer treatment. They can make conventional cancer treatment more effective. They can definitely reduce the side effects of conventional cancer treatment. But my request to all the patients is that please don't do it by yourself. Tell your oncologist what you are eating, what you are not eating. If you are even consulting some integrative person, tell that I am consulting, they have prescribed me this, so that it should not. And my preference is that both of the things should be, and it has, the person has to be an expert for that. They should interact, and we should understand, we should be sure that actually this is supporting and this is not causing harm. So
Right.
basically, first the thing is that yes, it can be done, but it has to be done under very strict medical supervision. Just to close the fact that yes, dietary modification can help. If the cancer has a glucose metabolism, low glycemic diet will help. But if the patient is on chemotherapy, he's already under, he's having nausea, he's not able to eat. If I add, I have seen patients who die because of this. They induce fasting on themselves, and instead of having a benefit, they go so weak that they would incur all these infections and ultimately succumb to the fact, which they would have not have done if they would have just gone with the standard way. So yes, it has to be done, but with a caution.
Yeah. With that, we wrap up this conversation. Thank you so much, Dr. Malhotra and Dr. Kabra, for joining us and sharing your views on this very important topic. Thank you so much, sir.